Hey, how you doing? This is Connecting the Dots with Cyril. And so the nice dots we're going to connect is about the amount of deaths and the amount of deaths from the coronavirus in the African American and minority communities. And so when we're looking at this, we have to look at it from another level that we haven't. And when I think about that, I think about working in the field of addictions for years. And typically what happens in addiction is I have a lot of clients, a lot of people come to me, they say, well, I love to get off drugs, but I notice that every time somebody gets off drugs, Mr. Max, they die. And so we assume that once, it's the getting clean that kills them and not the years and years and years of abuse to the body, the abuse of drugs, the lack of going to the doctors, the lack of healthy eating, and all those things don't play into the picture. It's only that they stop using drugs and now they're dead. And that's how the addict's mind looks at getting clean. And so when we look at this, the coronavirus, from what it is and how they say it operates, they say it's a sickness, and it's really a sickness, and it's really on the lines of like a pneumonia. But if you have pre-existing conditions, then the morbidity rate goes up. And morbidity means the death rate. The more underlying health issues you have, the more your risk factors go up. So, as I was saying, I'm in Baltimore, Maryland. And so today the figures came out for Baltimore, Maryland. So the figures came out, coronavirus cases in Maryland by race. And it says blacks. Black cases, 2,064 with 55 deaths. Caucasians, 1,540 with 39 deaths. Asians, 122 with 6 deaths. Others, which would be Hispanics, Latinos, is 449 with 3 deaths. And then there's data not available of 1,354 with 21 deaths. So they haven't even accounted for those yet, which category they're going to fall in. So that's in Maryland. And so then I was reading today, why is the coronavirus killing Black Americans at a staggering rate? And it was like Chicagoans is at 72%. Those who get coronavirus die, African Americans. And this emerged in Milwaukee, Connecticut, North Carolina, South Carolina, the Las Vegas area. And so pretty much everywhere where it hits, the rates of African Americans dying from this, and it doesn't matter the age. This isn't about age now. We're not talking about when they were saying that it was mostly seniors with underlying conditions. So what we're looking at now is age. So what's happening? So we know that most African Americans and people of color, minorities, have poor health habits. They have poor eating habits. They very seldom have see doctors. They high cholesterol, high diabetes, high rates of high blood pressure, high blood pressure. So those are all conditions of what happens in the African American community anyway. So regardless of what age we are, when the coronavirus hits us and it knocks us down, it begins to feed on all of those untreated and illnesses that we have anyway. So like in the African American community, you can be 21 and already have some health issues, underlying health issues, because you didn't get good prenatal care. You didn't go to the doctors and have your teeth looked at when you were a kid. Your parents didn't take you back and forth to the doctor because you were really on government insurance, or if the parents had insurance was so high that the co-payment was so high that they just didn't take you until you was almost sick enough to be dying. So when you factor in all of those issues, you can see how it affects us to a stronger degree. Me myself, 59, I have some underlying health conditions. I have gout. I have not high blood pressure. When it comes to high blood pressure, but I have hypertension. And so these are the diseases that when you get sick with the coronavirus, that it exacerbates. It feeds on that, and it begins to make you sick. So for us, truly, as African Americans, and my biggest fear was what happens when it hits the lower socioeconomic income areas. And so that's a big word that says, lower socioeconomic income. So that's a big word to say when it hits the ghetto, right? When it hits where the poor people live. When it hits those areas, it will run through here like a wildfire, right? And it will leave a devastation amongst all of the people, including our children who typically have malnutrition, right? Malnutrition is an underlying risk factor. So our kids who don't eat well, they don't eat enough. The oodles and noodles give them high cholesterol. They got juvenile diabetes. They go on borderline juvenile diabetes. So when this thing ramps up in inner city urban areas, typically African American, Latino, those areas, it's going to run through here like a wildfire. It's going to burn. And that dot that you see, the dot is, we already had the pre-existing conditions just based on how we've been living and how we've been having to exist, right? And then you get a disease like this that feeds on that, and it takes that disease, those underlying conditions, and ramps them up, and then fires them off. It's a very deadly combination. So I need my African American brothers and sisters and my Hispanic brothers and sisters. I need y'all to understand that you're not immune. This isn't a white man's disease. This isn't a disease that only affects white people. That's a myth, right? And the data, see, because as a scientist, that's who I am. Let's put the thinking hat on. As a scientist, the data is coming out that African Americans, when they get the coronavirus, they die at alarming rates, at higher rates than other people. And the fact is, we're already there. And so what Dr. Fauci said was, he knew it anyway, because he knew that when it got to the inner city communities, the communities of lower income, the communities that's really been abandoned, the communities of people who have been barely existing anyway, and their malnutrition is bad, their health is bad, and they're 30 years old, they're 40 years old, their children don't eat well. So that when it hits that population, it has the opportunity to take out the children, right? 5 to 6 to 7, 8, 9, 10. Then it has a chance to take out the teenagers, right? Then it has a chance to take out the young adults, 20 to 30, and then it moves on from there. Because within our communities, we exhibit a lot of poor health, and it's not based on us. It's based on the way we work. We typically work, paycheck to paycheck. Most of us are on food stamps. A lot of us are on work jobs that barely make enough, to pay the rent. That's more to go to the doctors and to pay for medicine and to pay for the right care that we need. So when it hits our communities, African Americans, it tends to create a higher death rate for us. And we got to believe that. I mean, we got to stop with this, passing cigarettes back and forth. Taking a sip of the wine and giving it to the guy beside you and let him take a sip, and then telling yourself that alcohol kills everything. See, I've been there. I know that. I keep telling y'all, 59 years in the game. So everything that we say in the game, everything you say in the game, I already said it. I know it, and it doesn't exist. It's not true, right? Alcohol doesn't kill the coronavirus because you've been drinking, right? And passing cigarettes back and forth is dangerous, right? Slapping five, the dap and the way that we greet each other is dangerous, and we have to begin to change those behaviors to recognize them for the danger that they are. There's no more walking up, hey boy, I love you I love you to life. That stuff, that's dangerous. That's dangerous. Here, boy, let me take a drag off of this and here, give you that. There's no, that's dangerous. And when I'm saying dangerous, it's not just dangerous for the person to do it, because we already know about the incubation period. We already know that it can incubate longer if you don't have underlying conditions. But if you have underlying conditions, the minute you get the coronavirus, it begins to attack those conditions, and you already crashing. Except for you've already went to your house, around your family who's also in the same physical condition and shape as you are, which means once it goes into an African American household, it has the potential to kill them all. You know, BB and CC Winans, BB Winans was on today, and he said, listen, he said him, his mom, and his cousin went to a funeral. Went to a funeral in March. Went to a funeral. And when they came home, everybody was sick. Right? Him, his mother, and his cousin went to a funeral, and they all got the virus. The cousin's in the hospital right now. This is what I'm talking about. The danger of this is we already are at higher risk for most things, just simply based on the way that we have to live and what we have to do to survive. That's just par for the course. And so my thing to you, my brothers and sisters, is listen, take this thing for real. Take this thing for real. This ain't no joke. This is not a game. This is not, the white man. This is not a game. This is going to come through the African American community, right? It's going to come through the African American communities, and it's going to devastate it, right? And we can stop that if we practice, right? Not just wearing the mask and the gloves, but we got to practice. I've been watching people walking around with the mask and gloves on. They standing there talking to you. They got the mask down around their head, and they smoking a cigarette, and y'all talking, and y'all still smoking a cigarette, and y'all talking. You got gloves on, y'all still talking. You smoking a cigarette, then you give him a hail, then he give you a hail. And what good was the mask? Because it's not your throat that's going to get, the virus. It's going to get in your mouth. It's going to get in your nose. And that's what you're trying to block. So having a mask on or having a mask up here or having a mask on your throat makes no sense or whatever. We gotta begin to get away from that. We gotta take this thing for real, because this is the thing that has the potential. This is one of those diseases that has the potential to decimate us, right? And believe me, I do not. In New York right now, there's so many people dead that they're just burying them in Potter's Field with no markers, that's crazy. And that can happen to us. And you see what's going on in New York. And that's because New York also has a high rate of what? African Americans, a high rate of Latinos, a high rate of people with pre-existing conditions. And the pre-existing conditions in this instance is the way that they have to live to survive due to all of the other stuff that happens to people of color. And we don't even got to get into that, because that's not the issue I'm talking about right now. What I'm talking about is how we have to begin to what? Save ourselves and protect ourselves from unnecessary chances to get infected. And then once we keep taking unnecessary chances to get infected, and then we take the infection home. That's the dangerous part. And that's the dots that I need y'all to be connecting. That we already have the whole, as a whole, not as a minor, as a whole. The African American and minority communities typically have underlying health conditions: malnutrition, high blood pressure, diabetes, gout, hypertension, cancer, the whole gamut. And then we don't eat well, so all of that plays into this particular virus, and this particular virus eats that and makes you get sicker and you die. The recovery rate for people with pre-existing conditions is slim to none, right? So we've been hearing how they talk about this, and I need you, African Americans, to understand this is not a game. This is not playtime. This is, you could be the one who get it, take it home, and kill your whole family. Because you didn't believe this could be caught or would affect people of color. And that's a lie. So listen, connecting the dots, just having a good time, trying to impart this in your mind, but not impart it in a way that I need you to hear it, feel it, but I don't need you to be like joking and laughing. And I need you to understand that we're in some serious times here, And right now, as this thing ratchets up in Baltimore, because it's beginning to ratchet up, it has the potential in the more poor urban communities to run through here like a wildfire, and you know, take a whole community, take a whole block, right? Take a whole city block, then take another city block, take another city block before we can get a handle on it. And it's our job, right? You heard them saying flattening the curve. So to flatten this curve in the low economic and in the African American communities, the flatten this curve is going to take you and me. Stop passing cigarettes back and forth. Walk around, put the mask on your face. Stop walking around talking and thinking it looks slick to have it around your throat. Start being proactive and taking care of yourself and protecting what? Not just you and your family, but other families who can ill afford to lose one member who's the breadwinner to this disease, right? So hey, if you like what you heard, you like connecting the dots with Cyril, you like what you heard, like me on YouTube, and then subscribe to my page, because I'm coming back with something else, and you're gonna love it, because I'm just educating you, man. It's my job, I believe, is to educate you so that you can begin to save yourself. Hey, just connecting the dots with Cyril. See you on the next one.